Hi, Dr. Daniel here, and this video is really just a follow-up to a post that I made regarding peptide therapies over the weekend. Following that post, I got dozens of emails, direct messages, and inquiries where really a lot of people were asking questions about peptides. And I just figured that if there was that many people inquiring, then there's likely others that have similar questions that just haven't reached out. And I thought it'd be easier just to upload a video to summarize some of my thoughts on those questions. And I'm going to try to be as concise as possible. First, how do you know if you can benefit from peptide therapy? Well, personally, my first goal in health and treatment recommendations is to always begin with optimizing your current state of physiology, using diet and lifestyle as the primary therapeutic targets. So what I mean by this is that we should be standing on a solid foundation of what I would call the non-negotiables, or low-hanging fruit, right, when it comes to optimizing your health. So what is that? What are the low-hanging fruits or the non-negotiables? Well, this is going to include something like a healthy diet, one that consists of nutrient density, high on the nutrient density spectrum, one that is unadulterated, right, as least processed as possible. And we also need to be achieving a certain amount of physical activity. So we need to be optimizing our movement. We need to be making sure we're getting enough exertion to send the necessary signals to our nervous system in order to operate the body as we want it to operate. And then there's recovery factors, things like optimizing our sleep or meditation, right? Internal work. This would be things like breathing practices. Now, quite honestly, if we do what I just mentioned, most of our physiology should work as it's designed. And I really only would consider someone a candidate for peptide therapy if they're addressing the basics, if they're already doing all the other things. But every now and then, whether it's because years of neglect or certain types of chronic health conditions that we have or that we've developed, or simply aging, we'll need some additional support. And in that case, I would still advocate for the most natural, functional approach possible. And this is where peptides come in. Peptides are a part of regenerative medical therapeutics. They are very safe. In fact, your body produces peptides, right? Peptides are tiny proteins that are made up of short chains of amino acids that our body naturally produces. And though our bodies naturally produce peptides, the production of them can vary greatly by individuals. And of course, as we age, the number and quality of peptides begin to diminish. And these peptides, they signal the cells in our body to perform specific functions. There are naturally occurring and synthetic peptides that we can talk about. They are known to stimulate growth hormone. They're known to support testosterone, to balance hormones. They will stimulate metabolic pathways. They help to regulate blood sugar. They can help to improve cognition. And these are really great for people that suffer from ADD, ADHD, or have brain fog. And instead of using some of the more dangerous stimulants, you could look at peptides, which are definitely more safe if we're talking about pharmaceuticals or getting a prescription to support our body. So they're great for brain function. They help to balance immune regulation. In fact, when I have patients with autoimmunity where we're just at the end of trying to figure out what's going on with them, peptides have a great way of balancing the immune system. They're really good for injuries. If somebody has a tendon injury that's not healing, whether this is a muscle tear, a tendon, a ligament injury, they're really great for athletes in that sense. And then there's also the enhancement of physical features, such as helping to produce lean muscle, skin, hair, and nails, right? A lot of these things that people are interested in. And if, again, you're doing all the things and you're not getting the results you want, it might be something that you consider. Now, how are peptides delivered in the body? Well, peptides are typically going to be administered directly into your bloodstream through what's known as subcutaneous injections. And this is a very similar process to somebody who gives themselves insulin. These are things that we can teach our patients to do on their own, either in person or remotely. It's pretty simple. It's a small little needle. It doesn't go into your muscle. It just goes into the skin and you inject it. There's also topical creams, nasal sprays, or oral lozenges that you can look at. It just depends on how we prescribe it. Now, treatment is entirely customized to your specific needs and goals. So in order to figure out what you need, of course, there has to be some level of assessment. Some of my favorite conditions to use peptides for would include hormone production and overall wellness. Definitely before somebody is thinking about hormone replacement, using testosterone or estrogen or progesterone, or if they have hormone imbalance, in my opinion, peptide utilization is one of the best things that you can use that is going to be safer, that's going to have less side effects, moving forward. In fact, there's no side effects from peptides, unlike using some of these other compounds, which can change the production, the natural production of hormones. Taking peptides, while it stimulates hormone production, it's not going to change the production that your body is doing internally. Another thing is for joint and tendon repair. So again, when I have patients that have chronic pain from an injury that's not healing, definitely joint and tendon repair is something to consider peptides for. Weight loss and metabolism. Again, there's so many people that struggle with metabolic errors. There's definitely some environmental errors that they can't control for, and peptides are a great way to improve that. Cognitive function and stress, like I said, it's really good for people that have cognitive decline. In fact, patients with Alzheimer's, dementia, ADD, ADHD, people that have had strokes that have cognitive dysfunctions, peptides are great for them. If you're experiencing problems with libido or sexual dysfunctions, and again, I would still say that we have to address the underlying factors there, because a lot of times if somebody is having sexual dysfunctions, there's some other issue going on, but this is a great way to help to improve the functionality short term. And then you have sleep disturbance. There's some amazing peptides that help to balance out our sleep dysfunctions. If you're interested in peptide therapies, or if you want to determine whether or not you're a candidate, simply reach out to myself. You can message me directly. You can email me. You can also schedule a consult with my team. There should be a link in my bio. So all you have to do is click there and you'll find a way to reach out and schedule a time to meet with me. This would all be the first steps, right? We would want to meet with you, see what your goals are, likely order some initial testing to just look at some of the baseline factors. What's your nutrient status like? What is your hormone profile like? Is there any immune dysregulation or immune cells that are abnormal that we can correct for? And then depending on all those results, of course, we can then put together a specific set of peptide therapies or a protocol that you can then utilize. Another thing to consider is time. Typically for peptides to be maximized in terms of their efficacy, you're looking at about a 6-month window. Definitely people will notice improvement within the first month of using them, but you're probably looking at about a 6-month treatment window to maximize the benefits. And then another important thing to consider is that while you can take them indefinitely, I would suggest that you do about 6 months and then you cycle off for a little bit, maybe about a week or two, and then you're going to cycle back on to continue, the benefit that you're getting. Hope all this makes sense. If you have any questions, like I said, feel free to reach out.